Well, many parents work from home during the thick of the pandemic, and now they're either going back or they are back, and that could actually trigger separation anxiety in kids, which is our topic for this morning's Maryland's Peace of Mind segment. And joining us this morning is Dr. Teresa Scott, who is a licensed psychologist with the Child Behavioral Health Solutions in Baltimore County. Good morning.
Good morning. Thank you for having me.
So what are you hearing from parents on this topic?
That there's definitely been an increase in anxiety in children overall during the course of the pandemic. I mean, we're in unprecedented times. Kids have been home with their parents for a period of 18 months. And some kids, the anxiety just occurs for a brief period of time and then they're able to adjust, whereas others, it's been more of a lingering issue, which is somewhat expected right now. I mean, they were in the safety of their home and they're re-entering a world where there's a lot of fear and uncertainty, and so it's going to take some time to adjust, but sometimes it can become a little bit more problematic and need intervention.
And kids in general aren't fearful of something unless it's brought to their attention. So what are some things that you can do to sort of lessen that for them?
Yeah, I think some of the things is kind of checking in with your kids. Like if you notice that they're fearful, some of the signs might be clinginess, having more temper outbursts. You notice they're struggling with separating from you. So you want to validate those feelings, try to ascertain like where the fears are kind of stemming from. Practice, you be positive, you kind of like check in with your own anxiety levels, reassure them that, they're going to be able to get through this, and you can kind of practice and take steps and create rituals and routines to help them feel safe and secure.
And so what age group does this normally affect? Because so many kids are already back in school right now.
Yeah, so we've definitely been seeing it in younger and school age children. It's not to say it can't happen in teens, because it definitely can. It just presents a little bit different. But I would say for the younger kiddos, like preschool age, in particular, it tends to be more problematic during that age group.
And so for parents who are dealing with that, what are some things that they can do to realize that maybe their child needs some extra additional help?
Sure. So I would say if some signs that indicate the child needs additional help would be if the child is experiencing anxiety that's occurring for like month after month, or typically 4 weeks or longer, and it's really interfering with the day-to-day functioning, disrupting family functioning. They're unable to stay in the daycare or school setting because of that refusal, then I would seek out the help or support of a psychologist at that point.
And then really kind of what is the treatment for that?
Sure. So the treatment typically involves cognitive behavioral therapy with exposure, where you kind of gradually expose the child to separating from the parent and learning to kind of cope with that fear. It also involves the parents, because they play a big role in it. So,
Sure.
Ensuring that they can kind of help the child through that. And then, if say CBT was not helpful, then you might look at medication options at that point.
All right, doctor, thanks so much for joining us this morning. Really appreciate it.
Yeah, thank you for having me. Appreciate it.